Contrary to popular belief, forensic anthropologists cannot determine cause or manner of death. In most jurisdictions, this proclamation can only be made by a medical examiner who is a medical doctor, who is a forensic pathologist, trained in such matters and given the legal authority to do so. Forensic anthropologists are limited to describing what they see on the bones and explaining if the defects are due to disease processes, called pathology, or injury, called trauma. For example, an anthropologist may not say that a hole in the occipital bone of the skull is a bullet wound that killed the person, even if by all rights this should seem obvious. Instead, the anthropologist describes the hole as a trauma, specifically as a circular defect showing no signs of healing around the beveled edges and that it is consistent with a gunshot wound. The actual diagnosis is left to the medical examiner's office. Trauma can be classified according to when it happened and what caused it. There are 3 when categories: pre-mortem, or before death, perimortem, around the time of death, and post-mortem, after death. Traumas all look different depending on when they occurred, and understanding their timing is essential. For example, perimortem trauma likely contributed to the death, whereas pre and post probably didn't, but can still answer questions. The what classes include blunt force trauma, sharp force trauma, projectile trauma, and miscellaneous. As you can see from the slide, different objects cause different types of traumas, and they all look different on the bone. Being able to tell law enforcement what caused a trauma and when it occurred helps them determine cause and manner of death. Trauma does not have to be violent or the ultimate cause of death of a person. Accidental injuries and some cultural practices also cause trauma to bone. Because bone is a dynamic, growing organ, it responds to assault in distinctive ways. Forensic anthropologists have learned from medicine the types of diseases that afflict bone or leave traces on bone. Pathological processes and trauma on bone are both interesting and often help to identify a decedent. While not strictly part of the demographic profile, disease processes that impact bone in life can help with the identification of remains. There's a lot of leeway with the range of normal human variation, but sometimes it's obvious that something is definitely not normal, like this slide on the skull, or like the skull on the slide. These abnormalities of the human skeleton are important for the forensic anthropologist to understand because they should not be confused with the perimortem traumas that may have contributed to the death or postmortem trauma such as weathering. Forensically speaking, most of the kinds of pathologies that impact bone would probably not help explain how a person's skeleton wound up in suspect circumstances. However, describing the pathologies, skeletal anomalies, and occupational markers can help law enforcement make a positive identification if the condition has been documented by a doctor or relatives. Pathological conditions that impact the skeleton may be caused by many things, including genetic disorders, birth defects, infections, and diseases, as well as poor nutrition or health, among other things. There may also be various skeletal anomalies that either can be used for identification or should not be confused with traumas relevant to cause of death, such as bones that are misaligned and fused together after a bad break, and extra bones or missing bones that may be unique to an individual or population. Look at the skull on the slide. I'm sure you can tell there is something wrong with it. Any guesses? Maybe it looks like the person was hit in the head by an axe? Or maybe it weathered in the desert under sun, sand, and rain. These are good guesses for a novice, but neither is correct and would send a death investigation in a very wrong path. In fact, this person suffered from a most severe case of syphilis, a venereal infection that, without treatment, will cover the face with lesions that erode through the soft tissue, the skull bones, and eventually into the brain. Estimating stature is a fairly straightforward procedure. Using an osteometric board and established formulas, a range for the living height of an individual can be estimated from different bones with varying degrees of accuracy. More problematic is estimating living weight because excess adipose tissue, fat, is not usually preserved in fully skeletonized remains. The best that can be done is to say how much the person would have weighed if the person was of a normal weight. Obviously, if the person was over or underweight in life, the weight determination could be misleading. Markers of occupational stress are caused by unusual and repetitive movements done for years as part of a job, a sport, or a hobby that can cause bone to be removed, grow in excess, or form lesions. Cultural practices can also cause alterations to bone that can be misleading. For example, the skull on the slide is exhibiting holes in it due to a cultural practice called trepanning or trephination. This cultural practice was mainly done in the past, where prehistoric peoples would drill holes into the skull as a response to some kind of illness, or perhaps persistent headaches, coma, or even psychological disorders that we might describe, medically today. A novice might look at these holes in the skull and think this person was bludgeoned to death or had an ice pick go through their skull, but in fact, this is a prehistoric skull that had undergone this process of trepanation at least 3 times. If you look closely around the largest hole, you can actually see that it had healed somewhat around the edges because they are sort of puckered and smoothed over. Postmortem damage can result from animal scavenging, dismemberment, burning, weathering, and so forth after death, and are important to understand in an overall investigation. Other things that can help establish identity of remains include surgical implants and dental implants, dental records, and other x-rays and medical records. Also, techniques in photo superimposition and facial reconstruction are sometimes done. The main objective of the forensic anthropologist is to compile a demographic profile for the remains, as well as assess any pathologies and traumas that are present on the bones, and any additional information on aspects of the individual's identity in order to aid the criminal justice system in their investigation. After a potential missing persons case has been matched with the anthropologist's report, positive identification may be made through comparisons between ante-mortem records, if available, and the remains. They may also be done using DNA, nuclear or mitochondrial, or Y chromosome analysis. The forensic sciences are made up of many different specialties, and forensic anthropology is but one. At the top are the coroners and medical examiners, who have the legal responsibility and authority to certify deaths and determine cause and manner of death. Medical examiners are physicians who have specialized in forensic pathology, while coroners may have no medical training and are often elected. Medical examiners and other forensic pathologists conduct autopsies on fresh bodies in order to figure out how and why someone died. When a body is too decomposed, burned, or in too many pieces for an autopsy, specialists in forensic anthropology and odontology are consulted. Forensic anthropologists help law enforcement with basic identifying characteristics of a skeleton, such as age, sex, ancestry, stature, pathology, and trauma. The police can then match the forensic anthropologist's findings with their missing persons cases or other leads on identity. Other forensic specialists include forensic odontologists, which are often practicing dentists, forensic entomologists, which use the presence of different types of insects and bugs and their life cycles to estimate the postmortem interval, and sometimes if a body was moved, forensic botanists, which do the same thing but with plants, forensic psychologists, which analyze the way a murder was committed to say something about the assailant, and criminalistics, which includes ballistics, trace evidence, DNA analysis, fingerprints, toxicology, among others. If you want to learn more about this topic of human osteology and forensic anthropologists, please consider taking my Anthropology 210 Intro to Forensic Anthropology course, which is offered only in the fall semesters. Next time, we'll start on the primates.